everyone. It's noon, and it's DrugFreeAZ.org, and it's our sort of monthly webinar series here today. And I'm really excited about this webinar program that we have here for you today because we've got a great expert with us on an emerging trend, and so we'll get started right away here. So let me just kind of get started with the title is N-Bomb, of course, a synthetic threat to our kids and communities. And one of the things we have to keep in mind is that, you know, all kids are exposed to these drugs, and drug use is starting very early, of course, you know, with drug use starting as young as 13. And for the first time, the Arizona Criminal Justice Commission actually asked our youth between, you know, 8th, 10th, and 12th grade, have you used one of these synthetic drugs? And surprisingly, 1 out of 10 reported that they had used a synthetic drug to get high. So what do we have in store for you here today? Frank LoVecchio, he is a medical toxicologist at the Banner Good Samaritan Poison and Drug Information Referral Center. And just to give you a little idea of what they do, they provide information about poisons, scorpion stings, adverse drug effects or problems with medications, chemical exposures, pill identification, occupational health, poison safety, and if you can believe this, in 2012 they managed more than 89,000 calls. So they do a lot of work, and they see a lot of these emerging trends. They're on the front lines there. And Dr. LoVecchio in particular has done really extensive work, one of the leaders around synthetic drugs, and he recently co-authored a report involving a Valley teenager who had used N-Bomb. So we're so grateful to have Dr. LoVecchio with us here today. And I'm going to change the presenter here and give him the controls. So thank you, Dr. LoVecchio, for joining us. We're really happy to have you with us for the webinar today.
Oh, thank you, young Shelley. It is a pleasure. Thank you, everyone, for coming. And I wanted to start by saying thank you. It's an honor. And overall, I try to stay out of politics and to try to give my bias on things. But I'll give you overall that I'm very, very against, you know, drug use, especially drug use in teens and in everyone in general, illicit drug use. And no one calls the Poison Center and says, hey, I had this great experience with oxycodone. I accidentally took 10 pills, and everything went fine. You know, everyone calls it for bad effect. So if anything, all about minimizing drug use, whether it be illicit drugs, synthetic drugs, over-the-counter drugs. So my bias is always to minimize these things. So if at times you hear me kind of joking about it, it's just to kind of keep things kind of light on a very difficult, somewhat topic. So I guess first and foremost, I'd like to be an educator, but also to be a good educator, sometimes you got to keep things light and be, for lack of a better word, a jokester. And I see we have 24 enthusiastic participants. A little bit about my background. I have, sadly, about 25 different jobs, but they all involve medical education. I have a degree in, in medical toxicology. I'm the co-medical director of Banner Poison Drug and Information Center. I'm the vice chairman of the emergency department at Maricopa Medical Center. And I'm a professor at the University of Arizona here, the College of Medicine. And I hold an appointment in medicine and pharmacology and emergency medicine. The important thing is that I teach pharmacology there, always trying to keep up on this stuff. And the good thing is I treat patients in the ICU at Phoenix Children's and at Banner Good Sam and at Maricopa Medical Center. So I feel uncomfortable talking about myself. I'll be better as things move along. But the point is, people are using many of these drugs to get themselves in trouble, and the way I got involved in this N-Bomb is kind of interesting. So we'll try to tell a story of a particular case or two. It's kind of new to the public, and interestingly enough, the public kind of caught on, and there was a, if you have a chance, Google it. I think I have an excerpt of it here. It was in USA Today. So to start, just for fun, those are not, that's not a picture of Austin Powers' teeth or my teeth, thank God. But does anyone know, if this was a young person, what he might be using? Oh, by the way, does it sound good? Is my sound okay? This is, I think, my first webinar. Yeah, is that okay, Shelley? Does it sound all right?
Yes, sounds great. Yes.
All right. So if you see somebody come in with these kind of teeth, you might say, well, you know, you really have poor hygiene, et cetera, but just think that they might be using, you know, a sympathomimetic-like drug. Now, what I mean by that is that they might be using methamphetamine, amphetamine-like drug, and I can't tell the difference what they're using, and it's unclear why, but there's really kind of interesting things, is that methamphetamine have been shown to decrease blood flow actually to the vessels high in your gums, but also the other reason is probably because you grind a lot when you're using amphetamines, and also because you're probably not as concerned with brushing your teeth, etc. The other really, really kind of cool thing that people have done is that to prevent this, especially in the ecstasy community, and as we know, most ecstasy sold in Arizona is nothing more than methamphetamine. That's also a great thing to tell kids, is to say, would you ever do methamphetamine? And they say, no. Would you ever do ecstasy? Yes, ecstasy is a pill. Well, did you know the great majority of ecstasy sold in Arizona is just methamphetamine, because all ecstasy is an amphetamine-like drug with mild hallucinogenic properties that you could barely recognize the hallucinogenic properties. Well, what the kids will do is suck on a binky or a pacifier. Okay, we call it a binky sometimes, or a pacifier, and it's to stop the grinding associated with it. Just kind of very interesting. All right, so overall we're going to talk about some novel drugs of abuse and highlight the differences. And in the end, you're going to say, wow, this guy LoVecchio is an expert. He really doesn't know much about this, because in the end, you're going to realize that this N-bomb, or this new drug of abuse, looks a lot and smells a lot just like methamphetamine, and methamphetamine combined with ecstasy. And that's essentially, if there's one take-home point right now, is what it looks like. It looks like a combination of supercharged methamphetamine combined with ecstasy, which rings a bell to, recently what we had, namely bath salts. And we'll touch a little bit on that. All right, so still, we're talking a lot to Arizona folks. I know people from other states kind of get on this sometimes. But the big four in Arizona, interestingly enough, are still, methamphetamine, marijuana, cocaine, and heroin. And when you look at drug seizures in Arizona, we see that marijuana, the seizures in marijuana are really, really high. And in methamphetamine, they're relatively low, respectively. But the people arrested for methamphetamine, et cetera, are much higher. And, there's many reasons for that. Kind of people with marijuana tend to stay at home. There's some government bias to kind of leave you alone if you do marijuana, et cetera. But we won't get too much into that. Well, one of the guys we have to thank for this is Gary Henderson for Designer Drug. And he coined the term, and it refers to chemicals that were used for recreational use to evade drug legislation. So that was what Designer Drug were first used for. And it started out in the 70s, and it is just unbelievable what you can do. And to cut to the chase with N-bomb, the two drugs or two chemicals that are used in the manufacture of N-bomb technically are illegal. And if you combine them, technically they're legal. And I can't comment on the law. I don't know if there's any law providers on the line or in the conference. But if they can say with 100% assurance for our listeners that N-bomb is illegal or 2CI is illegal in the state, that would be great. And what I mean by that is, well, I'll give examples of why it should be illegal and how you can get around arresting somebody if they do have it or use it. All right, so here's an example. Okay, and this was reported, I believe, in the Journal of Medical Toxicology. Okay, and it's a recent report that me and one of my colleagues, Dr. Levine, reported. 22-year-old man brought in by EMS, and his heart rate's really fast, his blood pressure's a little high, his temperature's kind of high. He's flushed, meaning that his skin is really red, he's diaphoretic, he's sweating his brains out. His heart rate is really fast. And we see their heart rates are really fast. The normal heart rate is between 60 and 100. Now, the thing with drug abuse, it's a disease of the young in general many times. And if this kid was not 22 but 82, I wouldn't be having this conversation. He'd probably be dead if his heart rate was going 180 miles, 180 beats per second. That would be the ultimate stress test, and he probably would have a heart attack and die. Okay? And it says intubated, which means put on a respirator, and he's given a drug, midazolam, which is very similar to Valium and propofol. which is kind of like a gentle anesthetic. And the reason for that is because he's so hot, so agitated. This patient in particular, without these drugs to put him in gentle anesthesia, required about 4 or 5 security guards, or 4 or 5 hospital police to control him. And the reason why I bring that up is it would have been just an incredible use of resources at Banner, and I think the right thing to do was to control him. And every morning or every 12 hours, I would try to shut off all the sedation, all the general anesthesia, and he still was very, very combative and not knowing anything. So this falls into some toxidrome called sympathomimetic toxidrome. I started doing this in 1996, and I still can't tell the difference between all the drugs that cause sympathomimetic toxidrome. And they fall into drugs like Ritalin, methamphetamine, just good old amphetamine, cocaine, etc. There's little subtle differences, but a lot of them cause you to have hyperactivity, maybe seizures, agitation, lots of sweating, high blood pressure, okay? And this guy was really, really sick, okay? And over time, we see CPK, which is something that breaks down your muscle. His muscles were breaking down despite him just kind of sitting there. His kidneys were breaking down. His liver function was very, very abnormal. And over time, he was extubated, or the ventilator was stopped. And, he developed some pneumonia. And it took 30 hours for this to resolve, so a very, very long time. So the patient said that he used bath salts, and we have a way to look for bath salts. We have a way to detect about the 15 or so products that people say are bath salts. And interestingly enough, just as an aside of bath salts, that they become more and more popular. Going back to what he said he took was bath salts, it was not bath salts, it was 2CI, or what we're going to talk about today, which is known as N-bomb. And N-bomb looks and smells just a lot like bath salts, or looks and acts a lot like, very, very super potent methamphetamine. When I say super potent, it seems to last longer, okay? So bath salts, we know, were very, very, became popular in Europe in 2007, and then they were banned and kind of brought over. It has nothing to do with taking a bath, etc. They're generally snorted, and they contain synthetic cathinones, okay? But somehow they made it to Arizona. And we see here, this, I believe, is from the Arizona Republic, or it got reported in the Arizona Republic. J.J. Hensley, I think, writes for the Arizona Republic, but I think this actual slide here is from USA Today, okay? And there are 2 18-year-olds who allegedly used this drug, and I think an 18-year-old actually died. And I don't want to comment on this case, specifically how he died or what he died of. I don't know all the details, but the thought was that he used this. And basically, there's a combination of a drug like methamphetamine, we'll talk about exactly what it is a little bit later, and a hallucinogen, okay? And technically now it was legal. So N-bomb is derived similar to mescaline, and remember mescaline occurs naturally in peyote. The technical name of the substance is phenethylamine, okay? Phenethylamine is sorry about that. Phenethylamine, because it's made from 2 substances, the 2 substances that are illegal. If you put them together, though, it's technically legal. And there's a way I think you can arrest somebody or say it's illegal, but I'm not by any means a lawyer or a police official. Okay, so here is another thing that is known as, we call it in the hospital, we call it 2CI, okay, or a psychedelic known as 2CI. I like that name better because it's more structurally of why it is, but some people, the other name for it is 2,5-I-N-B-O-M-E, and that's how it got its name, as N-bomb, okay, and it has nothing to do with it's nitrogen and B-O-M-E, okay, it has something to do with the structure, and that's why they call it N-bomb, okay. I have no idea how they came up with the name Smiles, okay. Some people call it 25I, okay, and I like 25I because it's a substitution on the 25I ring, but not super important. Now, the way people are arresting people on it, however, is that it could be considered an analog of 2CI, which is illegal. And you're allowed to arrest somebody if they have a drug that's similar to another drug that is clearly illegal. Okay, so there is talk of being, I don't know the exact way if you're allowed to arrest somebody on this, but so it's considered illegal maybe under the Federal Analog Act. Okay, and I'm told if you try to smuggle it over, that's how they get you. All right, so another case that we saw was an 18-year-old who was getting some imaginary insects inside a coffee shop, and he was consuming a controversial drug. He tried to wage a private bloody battle with the insects. They were eating him alive, so he was clearly hallucinating, okay? He struggled, etc., and he shed some clothing. So sound familiar? It probably does, because this is kind of what happens with bath salts, kind of what can happen with methamphetamine. So naked and agitated, we've probably seen that time and time again. And bath salts cause naked teen to battle imaginary bugs in Arizona coffee shop. Okay, kind of interesting. This is the container that it came in, and it made it to a European, interesting enough, website. The treatment for all of this stuff, for bath salts, for methamphetamine, is very simple for me to say. There's no antidote. I can't give you a pill and it's all going to go away. Really what makes it go away is time. Really, if you're dehydrated, I give you fluids. If you have a fever, I try to bring your temperature down by aggressively cooling you. If your kidneys are going, I do dialysis. If your liver's going, I have a lot bigger problem. You know, if you develop an infection like pneumonia, I try to treat your infection. If you're very, very agitated, I try to give you benzodiazepines or drugs like Valium. So saying something like supportive care is a lot what we do in the hospital. It's a lot harder to do. And what I mean by that is a lot of times, like my patient here, the few that I've had here, the few that I'm bringing up, the few cases that I brought up, is we end up many times putting them on a respirator, you know, wrapping them with ice, cooling them down because the heat can cause permanent brain damage, permanent organ damage, cooling them down, and then, you know, trying to support their organs, okay, and then waking them up every 12 hours to see if the drug is gone. There's not much we can do to try to get rid of the drug. It doesn't come off all that well with dialysis. This is a very, very busy slide that I'm not going to go over too much, but this is what people seek and why they do. They're always looking for like a new high, and this is what catecholamines do, like drugs like adrenaline, etc. And there's all different ways to do it, and there's somebody out there to try to think of a way to cause increased amphetamine release or a drug to block amphetamine by getting reuptake. Or in other words, you could make a new drug to cause increased release. You can make a new drug to block it from getting broken down, etc. You can get a new drug to block it here, etc., postsynaptically. So in summary, or talking to it, we sometimes take these drugs to increase alertness, to decrease appetite, but if you take a little too much, it can cause fast heart rate, high blood pressure, palpitations. It can cause, you know, hallucinations, and in overdose, which we never know, you know, how much is an overdose. It can cause this sympathomimetic toxidrome, which we alluded to. Now, I wanted to take some time to talk about this bath salts, and which it's very similar to the popularity. In 2010 at Samaritan, we saw 2 cases of it. In 2011, we saw 274 cases of it. And we, as Shelley alluded to, you know, we get 110,000 calls a year. Thank you, and please keep bringing them. We're a public service. Call as many times as you like. We're here to serve. The American Academy of Poison Control Center, which is all of the centers across the country, in 2010 for bath salts, or synthetic cathinones, as they're, you know, more technically known, 303 calls in 2010, shot up to 3,470 calls. Okay, so really, as of July 2011, only 28 states have passed laws to control these. So the question I have for you is, you know, where are the other 22 states or so? So if we talk about the chemical families, this might be a little too technical, but I wanted to bring something up here that if you really think about it, you know, these are not just truly amphetamines. Amphetamines would kind of go under phenylalkylamines or phenylalkylamines. They would kind of go under this ring-substituted amphetamines for the biochemists in the rooms, okay? And they would kind of fall under this area, okay? So technically, some of the bath salts fall under this. But the drugs that are gaining popularity, this is a busy slide here, but there are some really cool ones on here. And you see the 2C series here? That's what we're talking about here. There's another group out there called 2CBs, and there's another group out here that looks and acts similarly called Bromo Dragon, okay, and 2CB Fly. So you're going to see these come over, unfortunately. I think that we're seeing more and more reports in the litter of Bromo Dragon Fly, and we've seen a case or two of these. So be on the lookout. These are terrible. I don't want to say they're legal. I don't know. Like I said, I'm not in the game of legal or illegal, but I know you can buy these over the internet. So they act very similarly, just like this N-bomb, just like the 2CI series. Okay. So these are a list of some bath salts and their technical names, and I apologize. Some of you are excited by this. Most of you are bored by this. I wanted to show you what my typical patient looks like with 2CI or with bath salts or with N-bomb. Okay, and I'm going to go into the area. Shelley, are you able to talk? Are you able to see the screen here?
Yes. Yeah, we can see the YouTube screen now.
Okay. So there's a kid here who I'm going to blow up here from CNN. And here you see that spaced out look, that glazed over. This is a kid who's relatively stable with it. And you see that kind of glazed out look. And the interesting thing about him, like many of our patients, he's probably relatively stable. And, when interviewed later on, he knew nothing about this, okay? And he didn't remember anything about it, okay? And I think that's important, okay? The important thing about it is, the important thing about it is they usually don't remember any of it. So I talked about some of that Bromo, the dragonfly. Some of it's coming over now. We're catching it as something called magic. It comes over as plant feeder. I find that kind of intriguing. Shelley, are you getting background noise with that? Let me just shut off my web. I'm going to mute that for a second. Does that still work?
Yes.
Okay, sorry about that. I'll shut this guy off. So when you see things come over and your kids come over and they're buying plant food, et cetera, just kind of pay attention to that. And these are kind of for anyone. For anyone, and this, you could see this kind of coming over. Again, this is kind of popular in Europe, but we are seeing reports in Asia and the East Coast. So I wanted to show you kind of more of the same thing. These benzodifurenes are kind of this Bromo dragonfly and 2CB fly. We see street names of dragonfly and fly. Again, similar to what we're seeing now in this N-bomb, 2CIs. Okay, I think it's, I don't want to say, I can't predict the future, but it's going to be the next big thing. Okay, and this is what we think we're seeing. Okay, in Scandinavia, there's been a few deaths. It's making its way over here. A good way to smuggle it over is pretty easy to bring it over. It's not technically illegal here. Okay, it says onset of action is 6 hours. It's probably quicker if you do more. Duration of action is 2 to 3 days. It probably lasts longer if you do more. And I find this kind of interesting. Now, I am told you against drugs and stuff like that, but here are 2 package inserts that were found in the U.S., okay? And this is a PMA and PMMA. So this is kind of that Bromo dragonfly, very, very similar to the N-bomb and very similar to the 2CIs that I mentioned. Now, I don't know about any of you, but I probably would never snort something or inject something, for that matter, or drink something that had this package insert on it. This beautiful woman dancing with, I guess death here. And to go even further, another package insert that we found is somebody dancing with death. Kind of crazy, isn't it? And it's not a surprise that the deaths have been associated with hyperthermia, okay, or, very, very high temperature. Okay, so the deaths that we've been seeing in summary have been complications of sympathomimetic toxidrome or, being very, very hot, okay? So if you do see somebody like this, please, call 911, cool them down if you can. I mean, the way we cool them down in the hospital is usually ice baths, etc. If we can, cool fluids. I mean, it's one thing to throw them in an ice bath, but you got to make sure they're breathing, etc. And we talked about all bad things that you could get in the hospital. Okay. There's other things that we try to do here. Okay. I think it's beyond the scope of this talk, but in the hospital, we try to control their agitation. A lot of times we can do that pharmacologically by giving them muscle relaxants. A lot of times we paralyze them. Okay. Some of the newer tablets and the newer forms of 2CI that we're seeing here look just like the older ecstasy tablets. And the N-bombs, remember I told you that they were a combination of some older phentyramines or some methamphetamine-like drugs and ecstasy-like tablets. And there's some reports on the streets of making them tablet-like. And the beauty of it is, whatever is the hot topic, I heard that there were reports after President Obama got reelected that there was some with President Obama's face on it. Kind of really wild, you know. And, you know, they just kind of catch on. And it's all marketing, you know. I think it's kind of cool. Not cool to do, but. So there's another case in the literature which is kind of more of the same. Temperature of 105, so very, very hot, some muscle rigidity. And the patient developed some heart block, so very, very sick. They required dialysis because their kidneys get stopped, and they developed some syndrome called serotonin syndrome. And the interesting thing about this case is that, you know, remember I told you that it can lead to some, the pill usually is a combination of ecstasy-like properties and methamphetamine-like properties. Well, for whatever reason, this person developed more of the ecstasy-like properties. And because it was more of the ecstasy-like properties, they did develop serotonin syndrome. And the classic case that we remember with serotonin-like syndrome is the Libby Zion case, way back when that probably started our understanding, or you know, began the whole serotonin syndrome. The Libby Zion case probably 40 years ago in New York State that led to like the Bell Commission and all of that stuff. So piperazines, or PZP, is one of the first drugs that were used with this TCI, and it was combined with ecstasy. Okay, so I won't spend too much time on it. I know we talked about it, but in summary, if you do have somebody with it, one of the things we like to do is cool them, give them benzodiazepines, and try to support them. So overall, I think that compared to bath salts, compared to methamphetamine, this is very, very, very similar. I think that as part of a marketing thing, they're calling it N-bombs or Smileys or 2CIs. I think that on the horizon, on the East Coast, in China, Europe, they're seeing other things that are very, very similar, and there's no reason to believe that we're not going to see it now, namely dragonfly or bromofly, etc., especially because they have cool names. And for now, for us to detect it is very difficult. In our patients that we've had here, we can detect for certain bath salts. For this to detect it, right now we've worked up an assay at Good Samaritan, and it's something that we have to send out. In other words, it takes a couple of days. It doesn't really affect what we do when we're treating the patient, you know, because a lot of it is supportive, as I discussed. But I would like to say, I know I was supposed to go only for like a half hour. I went a little over, but I would like to take any questions there. And I apologize if I stole some of those paintings off, pictures off the internet there. I hope I didn't offend anyone there.
No, we've got, just so everybody knows, there should be a question pane on your GoToWebinar sort of menu. And so if you have a question, you can type it in to the question section there, and we'll ask Dr. LoVecchio. I've got a couple of questions for you here, specifically on, like, with Dragonfly and the, how are you, I mean, are you even able to tell, or is there, do we need to know if there's a difference between Dragonfly and bath salts? Because one of the things that we've been talking about is that bath salts are also called plant food. insect repellent, stain remover. Are those products really 2CI or N-bomb, or are those bath salts?
Well, technically, we have a big classification scheme of them and how they're made, and from like a basic scientist thing, they kind of fall into a different classification. But from a clinician standpoint, to make things easier, you would say, well, technically they don't fall into, bath salt because the ring substitution is different, and 2C or 2CI series. Now, right now, if you look at this slide that I have up, Shelley, are they able to see the slide when I do this?
Yes.
Yeah. So all of these 2CIs would kind of fall into this. And let's say they made this 2CI legal, I would kind of move down. If I was an unscrupulous drug dealer, not to be confused with the scrupulous ones, I would kind of make a 2CP and see what that did to people. And if you and I cured cancer today, or had a drug that cured cancer in mice, it would take us 17 years to see if it worked. These guys might make it in a lab and just give it to a drug user 17 minutes later and see if it works. So you would just kind of work your way down, So I guess what I'm trying to say is it probably doesn't matter all that much except to chemists. They kind of act very similarly because they kind of fall under this umbrella here.
Okay.
I don't know if I answered your question. I think clinically a lot of them are going to act the same.
We've got another question from a police officer who works in schools.
Oh, you do? Did he, can the police, I don't want to put the police officer on the spot, but if there's a police officer, can they comment on whether if I get caught with 2CI, would I get arrested?
I can ask him that. Yeah, we'll ask him that now. But his question for you is, if a person was under the influence of N-bomb, what would be the best? What kind of testing can be done to see if the substance is in their system?
Oh, okay. Okay, go ahead. I'm sorry.
Oh, I'm just sorry. Would it show up as like methamphetamine on a drug test?
The second part of the question is the easier part, and the answer is no. If you did a urine drug test, a simple urine drug test for methamphetamine, it would be negative, and it would not show for methamphetamine. It's different. And the first part is that if I saw somebody, I wouldn't encourage this, but if they just did a little bit of N-bomb, the first thing that would happen is they'd probably have dilated pupils, so their pupils would be big. They'd probably sweat a little bit. They'd probably be a little bit agitated. They'd probably grind their teeth. In the hospital, we'd probably find that their heart rates would go fast. Their blood pressure would probably rise. Then they would become, if they took a little bit more, they'd become more and more agitated. Their blood pressure would rise a little bit higher. They become more and more agitated, and certain blood abnormalities would occur. So couldn't sit still. So look a lot similar, very similar to methamphetamine. And they would hallucinate a little bit, maybe see things that aren't there. So the short answer is about the testing. If you did a urine test for methamphetamine, methamphetamine would not be there. It's totally different. If you did a send-out blood test and said, I want to look for all these drugs, I'm told that Phoenix, forensics, I know the forensic lab here, when people die, are looking for it now because we know we've had a couple of deaths from it. I can't comment pre-forensics.
Yeah, I think that answers his question there in terms of detecting it in a urine test and that kind of thing. It kind of, you're looking for a number of sort of reactions from the student. What are they hallucinating? Are they delusional? Are they, you're right, are the pupils dilated? That kind of thing. So those are all good things to look for in terms of a police officer working with students. So I hope we answered that. We've got another question here. We've got quite a few questions. And I'm not sure if you know this one either, but there is a question on there about, would these bath salts be more sort of attractive to folks based on the price? Is there a big price difference between meth and bath salts, for instance?
The price of these coming over, we're told, right now when they come over, we're told they're extremely cheap. Like when I heard extremely cheap, it's all relative, I guess, but we heard, for a packet or so, a little packet is about $30. And I don't know how long. I assume that, from what we hear from people, it gets them high for the night. And, I see a case here, a case there, and, we're intrigued by it, but I'm sure that's the numerator, meaning the people that make it to the hospital. I'm sure there's a lot of people that use it and never come into the emergency department. I think the attractiveness is they're getting around the law right now and maybe getting it off the internet, and having it delivered to their home.
And I've got another one. Do you know if the question's coming back on sort of the legality issue, is the base drug in 2CI or in the N-bomb, is it a cathinone?
Yes.
So that would be then illegal under the new Arizona law, because that the new law does make it all sort of synthetic drugs made from cathinones or cannabinoids illegal.
Okay. Well, technically the 2CI is a ring substituted phenylalanine. So if they say that it's a substituted cathinone-like drug, so they have to say it's like a cathinone, then it'll be considered illegal. But technically it wouldn't be considered a cathinone if you're a purist. I hate to give the defense attorney something to go by. So you have to be able to say it's like a cathinone. Cathinone is a structure.
Got it.
Isn't that terrible?
Yeah,
I feel like I'm Breaking Bad's attorney here. What's that guy's name? I forget his name.
Yeah, I can't remember what that is either. But one of the things we kind of, in talking about specifically with parents, one of the things that we've got a lot of drug prevention folks on the line, and one of the things that we always want parents to deliver is that I think making that that connection between methamphetamine, because you're right, our methamphetamine rates are very, very low, but our synthetic drug rates are so high now. And so some of the things that we as preventionists can share with the public is that, when they're talking with their kids, is that let them know that it's really impossible to know what these drugs contain, who made them, or what they're going to get. The idea that getting high no matter how carries a risk. We don't know the long-term effects of these synthetic drugs, and they are now dangerous drugs and are legal under the Arizona law. So those are some messages as those of us that work in prevention and work with folks across the state, is that having an understanding. I don't know that we need to go into such. Dr. LoVecchio gave us a nice overview and some education on this, but I think making some of those just simple, I think we can overwhelm parents with all this information about different types of synthetic drugs, but really with that generalized message of, getting high no matter how carries a risk, and also that these are just as dangerous as using like a methamphetamine. I was reading in one research report that said that using some of these, like 2CI and bath salts, it was like putting cocaine and methamphetamine in the brain at the same time. Would that be accurate?
It's hard to know exactly. It kind of depends on the dose, and it's, there's a track record with cocaine. I'm not saying, one is, I guess it depends on the dose and the concentration, and we just don't know enough about it yet. And I think you were pretty accurate, though, in saying that we don't know what's in it. A lot of people feel like, this is safer, maybe it's natural, or I bought it off the internet, it comes in a nice package. And it's just laws can only do so much, and I suspect in a year or two it'll all be illegal. But I also suspect in a year or two one of those other products will be making their way as a new synthetic drug.
Okay. And one other quick thing I wanted to ask you about is that there are a number of people, we've had stories of folks saying that they get these from as far away as Poland, and they're shipped into the country here, and that's how some folks get their hands on them. So it does seem that they are kind of available.
Yeah, it's unfortunate. I mean, post 9/11, you probably know they're, the scrutiny is not there as much for this kind of stuff, and the packaging for this kind of stuff, and that's why it's kind of sometimes thrown in as plant food and room freshener, etc. I guess it's due diligence, and it's hard for us too, and we can't we don't know about it until our patients come in with it. And we try to keep track of as much as we can in the literature. But there's a lot out there. And for us, it's kind of a fine line with educating the public and kind of, also giving them new ideas as to, what's out there and, what they can get their hands on to get high from. But we'd love to continue this of, new and emerging drugs and continue, this conversation with the Poison Center. I think it helps us both.
Absolutely. And I got a response back. It looks like under an Arizona revised statute that it's called methadone is listed as a material compound that would be illegal. So
awesome.
Yeah,
awesome.
So that would
Very
make
good.
it illegal then. If that's in bath salts or that's in 2-CI, so I think
good.
that.
We like that.
Yeah, so that
like
works
that.
in our favor.
And I'm glad because this is really, really nasty stuff, guys. I hope no one uses this.
Yeah. Well, thank you, Dr. LoVecchio. We know you've got patient care and everything to do this afternoon, and we really appreciate your time and sharing just your vast knowledge that you have on these new and emerging drugs because, sometimes once we find out about it, it's already been out for quite some time. So it really helps all of us, and especially in reaching parents who maybe just don't know what's gone wrong with their child lately, something's not right, and they just can't put their finger on it. And so this really helps us get the word out and raise awareness. So we appreciate your time today. And
pleasure.
Also, yeah, thank you very much. We'll look forward to doing this in the future. We'd love to.
Okay, I'd like a favor from you guys. If you guys could email Shelley or myself and just kind of say, hey, that was too in-depth, not in-depth, you spoke too quickly, too slowly, because we want to perfect this for the audience. And it's hard to know when you do webinars what you guys are doing. Usually you could follow people's faces, etc. Okay, so that would be good feedback, especially if we do another one to kind of perfect it moving forward.
Thank you. Yeah, and actually, at the end here, you'll get a quick survey once you click out of the webinar, and so there's an open box there. So you could even just leave a little message in that open box and let us know what your thoughts are. I think that would be great to get feedback. Thanks.
Yeah, that's good. Okay, thank you. Please fill it out. Thank you, guys.
Perfect. Thank you.
Thank you.
And just know too that we're here to help, whatever stage your parents or your community is in, whether prevention or needing to get help or connecting with us to get involved. Getting our e-newsletter once a month, kind of helping to keep up on latest trends and that type of thing is we're always here for you at whatever stage that may be. And just to wrap up here, again, Shelley Mowry, and that was Dr. LoVecchio. This is my email address, so feel free to email me with any questions or comments about today's webinar. That's also my cell phone number, so feel free to call me if you have any questions or would like me to get another question to the doctor that maybe we didn't answer here today. So with that, I appreciate your time today, and also our next webinar is actually some secrets to preventive parenting, and so that's going to be part of our summer series. So we'll keep you updated on those as well, and we hope you have enjoyed this webinar and hope you've learned something and appreciate your time. Thanks, everyone. Bye-bye.